Good afternoon, everyone. Can you hear me? Okay. Good afternoon, everyone. My name is Jane Levy, and I'm the Director of Patient Assistance Programs at Cancer Care. I'm a social worker by training, and even though I manage most of the agency's grant programs for patient assistance, I'm also a clinician, and for the past 15 years, I have led a weekly telephone support group for women with stage 4 breast cancer. It's free. We're hooked up all over the country. And to the patients and caregivers out there, I want to thank you for letting me share in your journey. I learned from you. Thank you very much. My topic today is paying for immunotherapy treatment. Cancer is an expensive illness, and as new and innovative treatments have become more available, many cancers have evolved from acute illnesses to more of chronic conditions. But the stress of worrying about how to pay for treatment is very wearing on patients and families and can negatively impact the way they manage and treat their disease. But help is available and knowledge is power, so let's get started. Paying for treatment, what you need to do. I call this Jane's 4 takeaways. Number 1, understand your insurance, what it covers, what your responsibility is. Find out about cost. When I started in oncology, that was almost 40 years ago, as an oncology social worker, talking about cost was really considered taboo, certainly impolite. You would never, ever talk to your medical team or your oncologist about what things cost. It would almost be embarrassing. You were here to fight your cancer. But the gloves are off with that for a whole variety of reasons, not the least of which the cost of care is so expensive. These drugs are expensive, and there's more and more financial obligation on the part of patients and families. You need to seek out and know who are the people to help you. It's too hard to do this by yourself, and you need to access patient assistance programs if needed. Insurance and patient responsibilities. Most plans will cover the prescribed drug as long as it is FDA approved for the type of cancer a person has. So that's the good news. The other news is the co-payments may be tremendously high, as many of you know. Coverage for off-label use is also possible, as Dr. Reardon said, but sometimes that's a little more complicated, especially with commercial insurance, and it may require some advocacy on the part of your medical health care team or an appeal to your insurance company in order for treatment to be covered. Figuring out cost. How do you figure out how all this costs? Well, the good news is you are not alone. There are a lot of people out there, they know more than you do about these things. They are patient navigators, financial counselors, practice managers, reimbursement specialists, specialty pharmacies. All are skilled in understanding the complexities of insurance and payment. And they can do a lot of things for you. They can initiate a benefits investigation. They can help summarize your benefits and out-of-pocket costs so you know what you're dealing with. And they can help start the process or help you enroll in a patient assistance program or a copay foundation. It's also important to understand your healthcare policy, and that's not easy. But it's important to speak up, and if you have a commercial policy, you can request that your insurance assign you a case manager, and that has been helpful to many patients. Or you can ask a patient advocate through your healthcare setting or some of the organizations that I will mention to help you go over your policy. Manufacturers' websites are also very helpful and have lots of good information, and we'll look at one shortly. And then, of course, there are patient advocate organizations. Some of them are disease-specific, some of them are more general. Cancer Care, Patient Advocate Foundation, Needy Meds, Leukemia Lymphoma Society, and on resource specialists at your center that can offer guidance and navigation, and they can give you information that's easy to read and understand. In terms of assistance programs, there are basically two types. Well, there are many, but there are two main types of assistance programs. One are pharmaceutical manufacturers programs, and those are drug-specific. You would apply to the manufacturer who's making the drug that you are taking, and these programs are for patients with commercial insurance. Then the other assistance programs are through Copay Assistance Foundations. These operate a little bit differently. These are disease-specific, so you will be looking for a foundation that covers your disease type, not necessarily the medication that you are taking. And these are to help patients with federal health insurance, such as Medicare. And that's because there are laws that prevent manufacturers from directly providing assistance to patients who receive government insurance. So that's why there's this arm's length setup where the drugs, where the co-payments are administered by nonprofit charities. A little bit about pharmaceutical programs. Again, as I said, they are drug-specific. And within those programs, there tend to be two types of program. One are for patients who are uninsured, or what is called underinsured, and patients with commercial insurance. For the uninsured, these programs are referred to as patient assistance programs. These are for patients who have absolutely no insurance or have insurance but a plan that excludes the medication, or they could be patients with high deductible plans. And if eligible, the drugs are often provided free of charge. Okay. Manufacturers programs. For patients with commercial insurance, these programs very often offer coupons with a small out-of-pocket cost for a copay for an expensive drug, or they provide copay cards that cover the entire cost of the medication. They also provide reimbursement specialists and benefit investigations. Patients, in order to be eligible, must meet financial eligibility guidelines, and these will vary from program to program. But I will say that some of them are really quite generous, so I would not be scared off from contacting them. Many people think, oh, I wouldn't be eligible. But these medications are very expensive, and a lot of the manufacturers would like to make sure that as many people as possible can have them. So I urge you to follow up. If you've never seen a manufacturer's website, here's just an example. This one is from Bristol Myers, and they're trying to make it friendly for patients. So you see it comes right out. Questions about coverage and cost, that they have the resources to help you, understanding the reimbursement process. You know, navigating coverage is confusing. They can help you explain and access the medication. They can help you determine your coverage. And as you see, you can speak to somebody live through an 800 number. The next type of programs I spoke about were Copayment Assistance Foundations. And these are options for patients on Medicare, TRICARE, federal employees. They're administered by nonprofit charities, and they are disease-specific. Income guidelines do apply. Again, they vary, so it's important to speak with a foundation that may cover your disease to see what they cover. They do provide assistance with co-payments and co-insurance, and many of them, and a lot of people don't know this, also offer assistance with transportation and insurance premiums. Okay. Each foundation has its own enrollment process with set financial and medical criteria that have to be documented. All are based on percentages of the federal poverty guidelines, and all are established by federal guidelines set up to provide copay assistance. If approved, most foundations will set up a third-party payer relationship with a pharmacy or infusion center or provide an access card for payment. And with the new tech platforms now, the approvals really are very, very fast if you call a copay foundation. There isn't a long waiting process, and they can help you get the documentation that you need. There are approximately 12 foundations nationwide. Some of them may be familiar to you. They are Cancer Care. We have a Copayment Foundation, Patient Advocate Foundation, Patient Access Network Foundation, HealthWell, Leukemia Lymphoma Society, Patient Services Incorporated, Good Days, and on and on. I have on the bottom a very good website for needy meds. Very, very helpful website, nonprofit, set up by a retired physician. He keeps an exhausted list of all the pharmaceutical manufacturers' programs, all the state programs, all the copay foundations. There's a copy of my slides in your packet, so all these websites are there. Just want to flick on our Cancer Care website to let you see what a copay website looks like. To the right there is the website for our Copayment Assistance Foundation. Through that website, you can view what diagnoses we currently have funds for. You can also start an application. The other side is our Cancer Care, is our social service arm, where I work, where we have many programs all free. They include counseling, support groups, Connect education workshops, free publication. We do have, beside copayment, we have smaller financial assistance programs and community programs. We're available by telephone at our 800 number, available online. We run over 200 professionally led patient and family support groups, and you can meet with one of our social workers for free at our offices at 275 7th Avenue and in New Jersey and Connecticut. Just a word about Medicare assistance. It's a complicated topic. People have traditional Medicare plans, they have Medicare Advantage, but I don't think a lot of people also know that there is state assistance for Medicare patients if you are a Medicare patient with a limited income and Medicare as your primary insurance. You may be eligible for assistance through a Medicare savings program. There are 4 different types of programs, and these are all state assistance programs that can help low-income Medicare recipients with some of their premiums, and in some cases, pay for deductibles, coinsurance, and co-payments if you meet certain conditions. There is also a low-income subsidy for Medicare prescription or Part D plans. I won't go into the 4 plans. They're kind of income-based, and some pay for different things. But what is important is that you can find out about these on the Medicare website. It's pretty easy to read. I've looked at it. Your Medicaid costs, or you can call the Social Security Administration. A little bit about expanded access and compassionate use. I'm not really an expert on this, but I think I can give you a little information. Expanded access, also known as compassionate use, refers to the use of an investigational new drug outside of a clinical trial by patients who do not meet enrollment criteria for a clinical trial. Only patients with no comparable or satisfactory therapeutic alternative are eligible to receive a product through the FDA's Expanded Access Program. A physician must submit a request to the FDA, and the company that makes the drug must be willing to provide it. There are 4 There are 4 types of expanded access programs. I'll just mention 2 that I think would apply to people here, and that's single patient emergency access, and that's an expedited request by the physician for an investigational drug for for single access, or single patient regular access to allow a single patient to join a clinical trial. You can find out about this. You can find out through the Office of Health and Constituents Affairs, the Expanded Access Program of the FDA. I don't know why I only have the 301 number, but if you go on the website, they have an 800 number too. And I have their email. They also, if you go on their website, they also have a further explanation of expanded access, and they are open to calls from the public, and they will talk with you. Costs associated with clinical trials. Well, there is no cost to participate in a clinical trial, and very often tests and medications are covered. However, costs may be incurred if you participate in a clinical trial. A lot of those costs have to do with travel and lodging. So travel assistance for clinical trials as well as regular treatment may be available actually through the clinical trial site themselves. Some major medical centers do have special philanthropic funding. Sometimes the pharmaceutical companies make extra monies available for patients on clinical trials to reimburse them for transportation, lodging, and meals. Organizations like Cancer Care, Leukemia Lymphoma Society. Let me tell you, there's never enough money, but we do have funds, and we can make small grants for transportation available if we have funding for a particular disease. And there is lodging assistance through organizations like the American Cancer Society, Hope Lodge. There's an organization called Joe's House that has a listing nationwide of places where cancer patients can stay. And many clinical trial sites have special arrangements, with hotel and motel lodgings. Just some helpful contacts for you. Again, I left you with our website. I'm a little biased, but I do want you to know that you can go on our website. We have these Connect Education workshops on many programs, including clinical trials, immunotherapy with some of the experts you have heard today, how to pay for treatment, and you can listen to some of the things that you've heard today at your leisure, including paying for treatment. I've listed our Copayment Foundation. Places like the Patient Advocate Foundation provide copay relief. They also have wonderful case managers that will help you apply for a lot of government benefits and entitlements. Again, Needy Meds lists all the programs, pharmaceutical and statewide, leukemia, lymphoma, your centers for Medicare and Medicaid. I'm embarrassed I left off my colleagues at the American Cancer Society, but they have a wonderful website that you can search by zip code to find particular financial assistance programs in your community. And again, your hospital social workers, your patient navigators, your financial counselors, your doctor's offices, and all of us at Cancer Care are here to help. Thank you.
Hi, this comes from one of our online users. I'm over here, if you're looking for it. but they're off in cyberspace, so don't worry about it. One of our users is concerned about if he goes into a clinical trial, that he signs a waiver, but the side effects might not be covered by his insurance. So do you have any experience with situations like that and how people can get that possibility covered?
Being coverage for the side effects?
For the side effects.
It's hard to say. That's where knowing your insurance would be helpful. And I would ask the insurance company to assign you a case manager, speak with them directly so you are not blindsided by any charges. That would be one way to go, or to enlist the help of your health care providers if you need to make some type of appeal.
Right, let's assume that the insurance won't cover it. Could you give a little more examples of how they could work with the, is there any chance that the entity doing the trial would cover possible side effects, or are there any other ways they could go about that?
Mean the medications for the side effects? Some of the companies that make medications for the side effects have patient assistance programs. So that may be one way to get coverage.
Well, since it's an online question, I don't have the full context of their personal situation,
Well,
but their concern is that their insurance has told them they might not cover
The
it.
insurance will not cover a side effect caused by an experimental drug, but the pharmaceutical company that's sponsoring the trial is responsible for that. If not, you can always take them legally to the ringer for that, because it's their drug. They're responsible at the end of the day for their product, whether it's on the market or not, and whether you've decided. You can always, I mean, that's just the reality of that situation.